Welcome everyone to the Equal Equity Show. I'm here with Lanai and we are just getting started really. So Equal Equity is a project in partnership with the National Youth Agency. We have been working for about a year now, working with youth workers of colour, looking at leadership, management and also policy. We're also looking into, at the moment, we've launched the Impact Incubator, which is working with 21 organizations. So we are supporting 21 organizations in terms of all the skills that they might need. So having access, having support, communities of practice as well. And that's what we've been doing so far. So would really like to welcome you to Lanai in the building, virtual house.
Hello, thank you so much for having me. My name's Lanai. I'm a student nurse and an activist, particularly around kind of tackling anti-Black racism. So I'm hoping today that at the end I can come in and speak about kind of health disparities and how we can go about tackling them.
Perfect. Thank you so much. I'm just going to introduce Dr. Rose. Welcome, Dr. Rose. How are you doing?
Hello. Hi there. I'm very well. Thank you so much for having me on board. So I'll just introduce myself. My name is Rosalind. I'm a doctor within women's health. I'm in my final year of training and I work mainly in South Yorkshire. I've come up with a campaign called Book Before 10, and that's what I'm going to be talking to you about today.
Perfect. Thank you so much. Lanai, I'll see you in a little bit.
All right.
Thank you. Thank you so much. I just wanted to find out a little bit more about you, first of all, and how you got into this. How you got into the role and why women's health is really important for you.
So I grew up and was born in Zimbabwe and then moved here when I was in my teens to study. So I did my higher education here and then went off to university here. I've always had an interest in women's health, but I think that became more apparent when I was in medical school in my third year when I did my obstetrics and gynecology placement. And from that day on, I knew that it is what I wanted to do, and I've not looked back since then. Why I like women's health, I think it's something which is very dear to me. My mom used to work as a midwife, and I think perhaps some of that interest originated from there. And I genuinely just enjoyed the placement in women's health, and I've seen how it makes a huge difference for women to receive appropriate care in pregnancy and beyond. So that's just where my passion lies.
Amazing. It's so interesting just hearing about, I guess, like parents and I guess children following the footsteps, similar footsteps to parents as well.
Yeah, exactly.
That's incredible. That's amazing.
Yeah.
Thank you. And tell me a little bit more about your campaign. I know you do, so you work full time and you do quite a lot, but one of the things you really focus on is campaign around women's health. How did that come about and how did that start?
As a trainee in obs and gynae for a while, I knew that Black women were at higher risk of poor outcome in pregnancy and afterwards. But then I think it became more apparent to me and I felt I had to do something about it, or I felt moved when the Black Lives Matter movement started, because I just felt, as somebody working within women's health, I am in the ideal place where I can make a difference. And I just felt that I had to make a difference because it didn't really make sense working within women's health and knowing that, Black women are at a higher risk of having a poorer outcome, but sort of just keeping it that way and just accepting that statistic the way it was.
Yeah, it's so important. I think there's so much, I know it's the disparities not only here in the UK, it's in America, it's in other parts of the world. So there's definitely something that's happening, right?
Yeah, definitely. There is that disparity is there, those inequalities are there. And after a talk I attended the other time, somebody said we should just stop admiring the problem, but we need to do something about it. And I think it's one thing to just keep saying, we're 4 times more likely to die, we're 4 times more likely to die. We need to be seen to do something in order to try and minimize that risk. which is where the campaign before 10 was born.
Amazing. And is it just yourself working on the campaign? How are you pushing forward? It's so important. Action is needed. I like that quote actually about admiring the problem but not doing nothing about it.
Yeah, exactly. So working on the campaign, it's myself and my supervisor from my project, named Dr. Jiraj, and we're speaking to different organizations, different charities like yourselves, to try and get more people on board to support this campaign in a bid to try and educate people who are at higher risk so as to minimize poor outcome in the pregnancies. So at the moment, it's mainly myself and Dr. Jivraj working on it, but we're very keen to get as many people on board, because the thing we care about the most is to get this information out there so that people can book in a timely manner.
Yeah. And what is I'm sure you'll touch on this, but what is the implications if people are not booking their appointments on a timely manner?
So research suggests that if people don't have appropriate antenatal care, they're more likely to have poorer outcomes, whether it's a poorer outcome in the pregnancy, worst case scenario, something like a stillbirth, or sometimes the mum can actually even have a poor outcome herself. So by people having appropriate antenatal care, we're able to minimize or to reduce poorer outcomes, which is why it's very important.
Okay. And is there an age disparity? I guess I'm thinking more from a youth perspective. Are younger women more likely to miss their appointments? Has there been any factors around age?
So regarding who are likely to miss the appointments, it's a bit tricky. I don't know the exact details off the top of my head, but I do know that people who have poorer outcomes are younger people, less than 25, or older people over 40. So in pregnancy, we know that those are the ages that are at a higher risk. So it's important really to try and catch anyone of childbearing age to make them aware of this important information. But I guess multiple factors, I think, are involved in why people may not book on time. So even some older people may not book on time, but it's just making people aware of that importance of needing to see their midwife early.
I think it's probably just like every other health appointment. I'm assuming, I haven't had a child before, so I don't know, but it's like the health appointments that you push back because you're busy and things are happening and you're like, I'll do this soon. And then I guess that soon doesn't always come.
Yeah, exactly. Some people, their appointments are delayed because of multiple factors, like what you're saying. If they've got other children, if they're working, if they're the only person in this country and don't have the support that they need in order to help them juggle childcare. So there are multiple factors, and it's not necessarily a case of sort of waving a finger at someone and accusing them of being bad because they've missed their appointment, but rather it's just about educating each other and getting the information out there.
Okay. And I'm just thinking about, like, when you said looking at people childbearing age, would we start younger? Would we have these conversations younger, or is it too young to have a conversation about pregnancy when they're not necessarily pregnant?
I think definitely the seed needs to be sown early before people are pregnant, just so that people know when it is that they need to book in with their midwives, or just know at least the pathway that they need to go down. Because I think, like you're saying, before I had my son, I actually didn't have that much of an idea how these things work, but it's having the knowledge that, okay, before 10 weeks, I need to go and see the midwife. And then once you've been to the midwife, they'll be able to get you through the pathway and direct you in the right direction.
Okay. And I'm just thinking about the COVID. I hate to say it, but I'm just thinking of maybe I know my health appointments have been pushed back. I don't even know how many months they were pushed back, but I'm thinking of, has that had an impact around women's health, like just not being able to have the appointments or have access to the appointments?
So antenatal care is something which is known to be really beneficial. So we haven't stopped women from coming in to have their antenatal appointments. So it's definitely something which is still up and running.
Okay.
In some situations, perhaps people may have telephone appointments, but it's not common. We're still seeing people face to face, and even at the peak of the pandemic, we were seeing women face to face. So other factors or other disciplines do have postponements in the sort of appointments that they were having with people, but antenatal care definitely should still be up and running as before.
I'm just thinking of, like, I don't know, I think I'm kind of tapping into some of the women I've worked with, say for example, like language barriers and not being able to, like, if you're not familiar with like the systems and the structures in the country around healthcare or education, how, I don't know what more could be done for like women that don't necessarily have like barriers around language and might not understand maybe the importance or maybe even like the process of how to access this support.
Yeah, that's a very key point, because an awareness of the system, of how things work, of the language is key, because how do you just turn up to a GP surgery if you don't know how to speak the language? How do you even know to go there? So in this campaign, I've also been speaking to various people to try and get the leaflets, which I've been making to encourage people to see their midwives before they're 10 weeks pregnant, to be translated into different languages. And once I go through the slideshow, the posters that we've made in order to encourage people to see their midwives in a timely manner. And when I've spoken to different hospitals, for example, Sheffield Teaching Hospital has taken the campaign on board, and they are putting up the posters in areas where women who are known to be higher risk live. And that's in a bid to try and get more and more people to book on time. But when I've spoken to other people, for example, in Blackpool, they're looking, or they had a way of translating the posters. So you just scan it and you get on a QR code, and then you get the poster in a language that the woman is familiar with. So there are different things, I think, that definitely need different avenues that we need to go down in order to get the word out to as many people as possible. And I think that's where I'm quite keen to get this campaign supported by more and more people.
Okay. And would you say, I guess, what can we do then as a community? I'm thinking of, I know we'll definitely go into the conversation, but is there anything that maybe, I guess, we as a community, maybe the youth sector, people that are already maybe in touch with young women that might be pregnant right now? I'm just thinking of some of the work that I've done. A lot of the young women I've worked with have had children really young and might not always have had the support. But from a community kind of perspective or a community lens, should we be doing more? And how do we do that?
It's known that the way people of ethnic backgrounds seek help is different from Caucasian people. We tend to perhaps speak to a friend, speak to a neighbor, speak to a relative before we go and actually seek help care from a professional. And I guess that's where we as a community come in, because if we are giving those young people the right information or signposting them to say, hey, before you get to 10 weeks pregnant, you need to go and see your midwife, then I think that's one way in which we would have played our part in a useful manner. Because as well, I think we've kind of touched on it, people coming from different areas, maybe not necessarily having been brought up here, the way the healthcare would have been delivered where they've come from may be different from how healthcare is delivered here. So if we are aware of what needs to be done, then at least we're able to send people in the right direction and encourage them to get the care appropriately.
Perfect. Thank you. Yeah, I think, it's just, I didn't know that you had to go to get checked out before week 10. I think it's a good piece of information. Now I'll remember before 10. It will be imprinted in my mind. So anyone pregnant, I'll be like, have you gone to go, have you done your checks before your 10 weeks? 10. I think it's a catchy, short, to the point kind of campaign, which is like really powerful because people would remember.
Exactly. And I think that's what it is. Sometimes people get pregnant and spend the first few months perhaps telling people. Sometimes in some cultures, people perhaps don't tell people until a certain time, until they've had the first scan. But it's that knowing that people need to go and see the midwife before they're 10 weeks. And that's something which is encouraged and recommended by is a national body, NICE, which oversees the care of pregnant women here in the UK. And I think the other thing as well to emphasize about this campaign is that sometimes people who are at high risk may not go and seek the health care that they need in an appropriate manner for different reasons, perhaps out of fear of the health system itself, or fear of being treated badly, or previous experiences. But the important thing is, what I would encourage people to do is to engage with the system, to engage with the healthcare. And if, for example, you don't get on with your midwife, or previously you didn't get on with a particular midwife, as opposed to delaying your antenatal care because you don't want to see any midwife, you could always just seek to be transferred to someone else that you think you've got a better relationship with, which would be a lot better than not having that healthcare at all.
And how easy do you think it would be to I don't know, I'm just thinking of like, how easy is it to ask for a different midwife? I'm thinking of the logistics and people's, the NHS and how it all probably operates. Is that something that is achievable? I don't know.
Yeah, it's definitely achievable, and it wouldn't impact on the care that someone receives. Say, for example, if someone requested to go to a different midwife, they wouldn't be like blacklisted and stopped from receiving appropriate care. And it's not even a case of speaking to the midwife that the woman was under to say, oh, I don't want to be under you anymore. Usually there's a hub, a number that you can call in order to access the community midwives, and then you just ask to speak to somebody there and ask to be for the care to be under a different midwife. So it shouldn't be something people should dread or people should put off and just sort of grin and bear it if they're not having a good relationship with their midwife.
Okay, that's really good to know. Thank you.
So I think one of the things that I thought about, or that where this campaign started from, was initially we didn't know what the numbers were or who exactly was booking late. So we did an audit in Sheffield, which is where I was working at the time. And there we can see the graphs. So we compared, you know how you mentioned about COVID. We looked at 2019, which is the blue columns, and compared the same time period, July to September, with 2020, which is the yellow. And the reason we compared 2019 to 2020 is because in 2020, that's when the COVID-19 pandemic was there. And we wanted to know whether that would have made a difference at all in how people were attending their antenatal appointments. And we can see that sort of at first glance, people of all ethnicities were attending late. So, but then when we compare 2020 to 2019, we can see that there were more Black people who attended late compared to the same time period in 2019. And when we look at the people of Asian origin, it was slightly reversed. It went down slightly in 2020. So people were attending on time more. But then with the white British, we can see that more white British people were booking late before the pandemic as opposed to after. And I think the reason this was quite important, or why we thought it was important, was when the pandemic first started, we know that people in the BAME category were the ones who were more likely to have poorer outcomes because of COVID. And we were quite intrigued to know to find out whether Black people were perhaps keeping away because they were worried that they would have COVID more or would be at more risk of COVID. Why the numbers went up in 2020 compared to 2019, we don't really know. We've not looked into it that much. But I think the important thing that came out from that is that we felt the need to emphasize to people of color that no, yes, COVID is out there. People are suffering from COVID, but antenatal care is really important. So in spite of the COVID-19 pandemic, people still need to be coming in to have their checks. And it's really important.
Wow. There's so much to take in. I think it's just good to see the visual of what pre and post. I think we might make assumptions, but actually
it's quite a significant, like a big jump. It's quite a big
curious
jump.
to find out if that was the same for London as well. I don't know if it will be different for different regions.
Yeah, exactly. And over a longer period of time, what that would look like, it would be quite interesting to know as well. But then from that little snapshot that we saw, we just thought, oh no, this is something which needs highlighting. Whether it's something which is going on in the whole country or not, it's just something that made us think, hey, we need to get this information out there and encourage people to book on time.
Okay.
So one of the things, that we were thinking about was, why is it that some people can book late? And one of the ways it was described is that some people know that they're pregnant and actually choose not to book on time. Some people might not know that they're pregnant. And then, like what we discussed about, there may be delays in the processing of things and then resulting in someone not booking on time. And we know that there's some people who have had poor experiences in maternity care, like we discussed earlier. And perhaps people may choose to not attend because of that reason. And the other thing we know about as well is that there is a history of racism within women's health. And perhaps people will be like, oh, we're 4 times more likely to die. The system is against us. And they may choose to go not to book on time for that reason. The reason I chose to focus on this actually is because this little instrument right in the center of the screen, that little silver thing, it's a sim speculum. That's what it's called, and something that we use right now, even in clinical practice. I didn't really know much about the history of the speculum, and then I did a bit of reading. And the chap there in the bottom left-hand corner is the one that this speculum is named after.
Okay.
And the speculum is used to examine women when they've got a prolapse, a bulge essentially in the vagina, to try and work out where exactly it is that we can operate on it appropriately. But the way he came to fame and got known as the father of gynecology was through operating on slave women who had issues sort of down below with fistulas, which is an abnormal connection between the bladder and the vagina. And 3 of them we know quite well. One, Anaka, is one who's known to have had up to 30 operations. And she was only about 18 years old. And what makes it even worse is that she had no anesthetic at all. So you can only imagine the pain and the suffering that this woman went through. And I think sometimes people may perhaps associate the history of racism and poor treatment of Black people and sort of be afraid or choose not to engage with the services as a result. And interestingly, when a charity which is called Birthrights, it's looking at some women's experiences. Unfortunately, these sort of poor treatment or poor experiences still extend to this date, with some women saying they were feeling unsafe, some women experiencing racial stereotypes, having pain relief denied while they were in labor, some people thinking that or feeling as though they were being treated as pests and as nuisances, racial microaggressions, and people just thinking that they were receiving differential treatment. And I think this it would make absolute reason why someone would avoid engaging with the service if this is how they felt. But I think what I would emphasize about this is, if you feel you're getting differential treatment, if you feel the care you're not getting is appropriate, then you're well within your rights to complain. Every hospital has a service which is called PALS, Patient Advice Liaison Services. So if at all a woman is feeling that they're not receiving the care that they should be getting, my advice is, as opposed to not engaging in the process, it's better to make a formal complaint, and then the matter will be dealt with appropriately, as opposed to...
Sorry, I'm just thinking, Dr. Rose, how does it work from a I guess from a medical perspective? I know, for example, in prisons they've got someone that's independent that might come in, same with schools, Ofsted, or any complaints. So if a young person or a woman of any age actually puts a complaint in around, let's say, racism and feeling like they're not being listened to within that service, who then decides? I guess, how does it work in terms of the process? It might just be helpful.
Every hospital will have a team which looks after things like governance, to do with things like complaints, and also the patient advice liaison service is separate from the clinicians. They're a group which just deals with liaising with patients and giving them advice. So they tend to deal with the sort of receive the complaint and then pass it on to the appropriate department. And within that department, we usually get independent doctors or people not really involved in the case to review it in order to try and identify whether there are any areas where substandard care has been provided. And also the lead clinician is also given an opportunity to respond to that complaint, but definitely an internal investigation does occur, which is not led by the lead clinician. So people should be assured that A, the care won't be compromised, and B, it's not going to be sort of swept under the carpet.
Okay. And is there anything is there an independent body that people can contact, or is there that you can whistle blow, or there's in every structure, there's some sort of somebody else? The complaint process is not taken seriously. I'm just thinking of some people's experiences. Some of the women I've worked with definitely have had really significantly horrific experiences in medical care.
People can refer if they feel that their grievances haven't been dealt appropriately. Then they can. There's the GMC, General Medical Council, which oversees doctors, and then the NMC, the National Midwifery and Nursing Council, which oversees midwives and nurses. So if they feel that the hospital hasn't dealt with the complaint appropriately, then they can always escalate beyond the hospital.
Thank you. That's really good.
But I think the key thing to say is that people's negative experiences shouldn't result in them choosing not to engage in the process, just because ultimately you will come to potentially a poor outcome by not engaging. So it's better that you engage. If you have problems, you escalate, because growing up in Zimbabwe, for example, you wouldn't really argue with a doctor. The doctor would say something to you and you'd be like, okay, then go straight off and do. But it's totally different here. A patient's rights should be observed. A patient's voice should be heard. And if at all a patient feels any of those things are not being done, then they need to escalate it in order for their concerns to be dealt with. And it's helpful not just for them, but also for other women to come.
Yeah. Is there I'm just thinking of, I don't know, Ethiopia. I was in Kenya as well this year, and I was reading stuff around women's health, and I'm just thinking for for Zimbabwe, is there any I guess is the healthcare for women, especially around pregnancy, is it very different? Is it I don't know, I'm just reflecting on different parts of Africa, or maybe the parts I've been to. I haven't been to Zimbabwe yet. I will go soon. As soon as the borders, as soon as they let me out, I'll definitely fly.
I'd imagine the healthcare will have some differences. For starters, there's no national health service, which we're fortunate to have here. But unfortunately, I've not actually worked in Zimbabwe as a doctor, so I wouldn't be able to give you more accurate information.
Okay.
So going back to sort of thinking about why some people may book late. Some people may book late because they actually don't know that they're pregnant. And this may be key for, younger people, for example, where they don't quite know what the signs and symptoms of pregnancy are, or people who have previously had difficulties getting pregnant and don't think that they could get pregnant, and somehow they then get pregnant and don't go and see the midwife on time. So that is one of the reasons why people may not attend for the midwife's appointment before they're 10 weeks pregnant.
Okay.
And then the other thing that we talked about earlier was about things being delayed. Sometimes they can be delayed because the person perhaps puts it off till a later time. But sometimes delays can also happen because of the system. Perhaps somebody doesn't refer them on in an appropriate manner, or they call the GP, the receptionist, and then they say, call back another time. And for one reason will lead to another, resulting in the person delaying their antenatal care. But this is where I think it's quite key that if we know that we need to be getting that antenatal care before 10 weeks, people should then pick up the phone and make that phone call to say, hey, I'm approaching 10 weeks. I still haven't seen my midwife. Is there a potential delay in the system? And just sort of nudge people in order to make sure that they aren't missed as a result of some sort of bureaucratic or some issue with the system.
Okay.
So coming on to, we sort of talked about it a bit earlier as well, about why it's important for people to book on time. And I quite like this because it's a visual way of representing the information which is available. And this is from an organization which is called Embrace. And it looks at all the data from pregnant women and the outcomes of their pregnancies, and just comes up with summaries of different themes which have sort of become apparent when they look at the data. So this is data from women between 2016 and 2018. And unfortunately, during those years, 566 women died.
Wow.
In pregnancy and within a year after the pregnancy. And you can see the different risk factors that are there. Obesity, and circled in red is the delayed antenatal care. 107 women, which is 19% of the women that died.
Wow.
And then there's also the people of a minority ethnic group. We can see that 119 women from minority ethnic groups, which is 21% of the women that died were ethnic minorities. 216 were people born outside of the UK, which is about 30%. 38% of people that died were born outside of the UK.
That's
so
really interesting.
Yeah.
The difference between born outside of the UK and, I guess, ethnically diverse people. I wonder if there's language barriers. Is it kind of health issues from prior health issues? I don't know. I'm curious to find out, but just interested.
Yeah, it is very interesting, and it makes you start thinking about, is it that English? Is it differences in language barriers, like you're saying? But then we can see that there's non-English speaking people, which was 23. So not all of them were non-English speaking, but perhaps the comorbidities that people may have, or even different health conditions that the people may have had. And in the past, I think the disparities in sort of Black people being more likely to die were always being put down to things like Black people being at higher risk of diabetes, being at higher risk of having high blood pressure, which would make the pregnancy more at high risk. But there's a study which is currently underway to find out whether there might actually be other things like differential treatment. And it'll be interesting to know whether that may also have had a bearing on poor outcomes. But it's from this that our campaign came about, because we can see that delayed antenatal care is 107 people that died and of those people that died, they had not had the antenatal care in a timely manner. So that's when we thought, at least if we can remove one of those biases, we can't necessarily change where someone was born, we can't change their ethnicity, but at least if we can make people have that awareness that, I need to book on time, then that should remove one of the risk factors and make it less likely that people will have poor outcome in the pregnancy. And it's not to say it will get rid of the risk of people having poor outcomes completely. No, it won't. But at least we will be able to intervene early as healthcare professionals in a bid to try and minimize the poor outcomes. And then this is the facts and figures that we were talking about earlier as well, with Black women being 4 times more likely to die than white women in pregnancy.
Is that a current statistic? I'm just seeing 2021 on there. Is that like a current?
So yeah,
Okay.
Unfortunately, it's a trend. So if we look on this graph here, Black women have always been at a higher risk of poor outcome in pregnancy. And we can see from as early as 2010, Black women, which is the cross at the top, our risk of poor outcomes has always been higher. And it continues right now, 2021. So this graph goes up to 2018, but 2021, it's still the same statistic that we are more likely to have a poorer outcome.
Wow.
Which is a sad fact, really.
Yeah.
But I think still going back to what that lady said, instead of admiring the fact, let's take matters in our own hands and let's try and take a step in order to try and minimize Black women or all women really having poor outcomes.
Wow, I'm shocked. It's the same kind of. Am I shocked? I'm not shocked. Probably not shocked. But it's thinking like, yeah, it's been an ongoing issue, and you're right. Where, yeah, it just feels like a continuous thing that's just rotating and rotating. Internationally, I've got family in Canada and America, and they've had, again, experiences, but not positive experiences as well. So it's it's making me think around actually what more can we do. So yeah, definitely support Dr. Rosa's campaign. That's step number one.
Yeah. And the other statistics, so there we were talking about mums having poor outcomes, and then Embrace again has looked at the risks of stillbirth, and we can see that the highest rates of stillbirths amongst Black or Asian women over 35 and in deprived areas. So the poor outcome also continues after birth with neonates, so newborn babies. Those that are likely to have poor outcomes, again, Black or Asian, under 25 or over 35 in deprived areas. So I think it's not just a case of wanting, this definitely isn't like a scare campaign to try and scare people into action, no, but it's about knowing which people are at risk and targeting those people in order to make sure that those people at highest risk in pregnancy and beyond get the information, get the knowledge, and it will be able to empower them to make the right decisions so that they're less likely to have a poor outcome.
And we're literally in the 16 days of activism around gender-based violence at the moment as well. So it's actually interesting just thinking about maybe the women that are at risk as well, or people that identify as women that are at risk in terms of like abusive relationships and things like that. And could that be a barrier in terms of them having access to hospital or hospital appointments as well? Those kind of social factors.
Yeah, definitely. They definitely play a role. They definitely play a role in, for example, if someone is in an abusive relationship, they may know they're pregnant, but just not be empowered enough to go and seek the healthcare that they need out of fear or out of the abusive relationship that they're in. If someone is being sex trafficked, or if they're, for example. So multiple reasons why people may not be able to do it. But then which is why I think it's important to get the information out there in order to try and help these people best as we can. And in this campaign, I've tried to speak to, I'm in touch with a charity which is in Kirklees, and they deal and support women that are in sort of abusive relationship or people who've been victims of domestic violence. And I think the key thing is to try and get the information out to all those high risk people in order to minimize them coming to harm.
Yeah.
So I think one of the things to highlight or to emphasize is why this is important, because perhaps I've sort of touched on some of the reasons, and the way of thinking about it, or the way I've thought about it, is that there are different targets which the government has set and put in place. And
Okay.
one of those is called Saving Babies' Lives. And there's a new bundle which was published, a new version of it, version 2. And in it, they identify key strategies to try and minimize women from having stillbirths or try and reduce the risk of stillbirths. And one of the things which is known to be very helpful to minimize stillbirth is smoking cessation. And the reason it's important for a woman to book before 10 weeks, if she's a smoker, for example, is that there is lots and lots of support which is available to try and stop mums from smoking in pregnancy, because we know it's associated with a poor outcome for the baby. The baby can be a bit smaller, preterm delivery, and it's even a risk factor for stillbirth. So if a mum engages with the maternity unit, with the midwife earlier, then she can be supported in order to help her to stop smoking and minimize the risk of the smoking to her and to the baby. If a mum is coming to the pregnancy and is booking later, she's less likely to stop smoking. And also the smoking is more likely to have had a harmful effect on baby. So that's why it's important that people engage and book early, and that way we'll be able to better help them to stop smoking. And I think the thing to emphasize with the smoking cessation program as well is that support is available. If, say, for example, the partner is also a smoker, the couple together can work together to try and stop smoking, which is more likely to be successful.
Okay.
The other thing, the other reason it's important for people to book and see their midwives before they're 10 weeks is because we know that babies that are a bit on the smaller side are associated with a poor outcome. So babies who are, or women who are at risk of small babies are women who have high blood pressure, women over 40, women with diabetes. So there are multiple risk factors that are there. And it's only when the midwife has gone through a woman's history that she'll be able to tell which woman is at high risk of having a small baby and which woman isn't. And those women that we identify as having high risk of having a small baby, we tend to start on aspirin, a low dose of it, but we tend to do that before they're 16 weeks. And the reason that we do this is because it's proven to improve the blood flow to the baby and minimize the baby being small. So if a woman is booking late, then potentially should have missed that window between 12 and 16 weeks where we recommend starting the aspirin, and that may put her baby at risk of being small. And the other thing we do as well is we can do some extra scans to monitor the baby's growth and make sure that the baby's growing well in order to identify those babies not growing as well as they should. So that's why it's really important that women see their midwives early so that they can be assessed to see if they need any further intervention. The other thing is preterm birth. We know that if babies are born early, they're at a high risk of having some problems. Things like cerebral palsy is definitely more common in preterm babies. So there's now a huge drive to try and avoid preterm birth. And there are interventions that we can put in place to minimize the risk of someone going into labor early. So sometimes we can give medication, progesterone, a hormone, which will try and keep the baby inside and stop the woman going into labor. And in some women that we think are at a moderate risk, we can do scans of their cervixes to see how long the cervix is. And if there's any sign that the cervix is getting shorter, we sometimes can put a stitch around the cervix, keeping it shut, that way keeping baby in place. So it's really important that people sort of come into the system and are identified to see if they are at risk of having a baby early. And then that way we're able to put in the measures in place to minimize that happening to them.
Is there anything around, I'm just thinking of vulnerabilities and maybe just women that might be struggling with their mental health and things like that. Is there anything around, just support for women that might need additional support to help them have access?
Yeah, definitely. Because once a woman has a mental health history, she's pregnant, that can be made available. The woman is advised really to make that knowledge available to the midwife. And depending on the level of support that the lady needs, sometimes there's a service that we call the perinatal mental health team, and they can support the mum in the pregnancy throughout. It's a team of people, which sometimes includes psychiatrists, and they can provide the mum with the appropriate support. So it's really important. We aim to look after the mum as a whole, not just like physical health needs or just the baby, but rather we need to make sure that we've got a well mum, so that she can be well enough to look after herself and her baby.
And one more thing, I'm just thinking about, there's been a few critical incidents in terms of women giving birth in prison. And again, the lack of care and things like that. I'm just thinking of just women, maybe my background's been in prison, so I'm thinking of women that might not necessarily have access. I don't know if they do the 10-week scan. I'm just thinking of like the reality of prison sometimes, and not always having the same level of care they would have if they were in the community. I'm just thinking of those women that might also be high risk.
I think definitely women who are in prison would be classed as high risk. And they should, I don't know much about the healthcare within the prison system, but women shouldn't be discriminated upon and shouldn't be denied the same healthcare that a woman outside of prison receives. So I think it's important, then definitely I need to speak to somebody within prisons and make sure that women in prison also have this access to the midwife before their 10 weeks, because it is a right that they should be able to enjoy as well. The other important reason why people need to book with the midwives early is because nowadays there's so much emphasis about being aware of the baby's movements, and we know that the movements are a sign of baby's well-being. Previously, people used to be told like, oh, if a baby moves 10 times, then that's okay, 10 times a day. But research has shown that that's absolutely not true. It's a case of being aware of the pattern of movement. And the moment a mum notices a change in the pattern, then she needs to get help. And I think this is a message that we make sure that every pregnant woman is aware of. And if someone books in late, then potentially if they've had a pregnancy in the past or things were different then, someone may advise them that, oh, if babies move 10 times, you're okay. But that's actually not the correct up-to-date information. So again, that's why it's important that people book with their midwives, that they'll be given the up-to-date information and when to seek help in order to avoid them having poorer outcomes. And then the last thing to just mention is about personalized care, because we do know that as healthcare professionals, we can sometimes advise people and tell them that, oh, we'd recommend X, Y, and Z, but people are well within their rights to go against that advice. But I think the best thing to do is for us to engage with women early than a woman coming in to see us when she's 2 days from her due date. And then we're now giving her information, say, oh, we recommend this. And then there just isn't enough time for that dialogue to be had. And there's not enough time as well for the woman to perhaps do her research and say, oh, okay, what is it that these people are talking about? Is it important that I do it? And then in the end, it ends up with the woman being a bit disgruntled because we're not wanting to provide her with a particular thing that she wants. And us also slightly stressed, like, oh, we need to try and make sure that we do this for the woman as well. So it is quite important.
And how would, I guess, for anyone watching, how can everyone get involved? How can people support you? What is it that they can do as well?
So I'm very glad to come and speak to anyone who's got time to listen and feels that the campaign would be beneficial in the area that they work in. And I think spreading the correct information is something that I'm completely passionate about, because people sometimes may come to us to get information, and we just need to make sure that we're giving them the right information. Please do have a look at our Twitter handle at bookbefore10. Please follow, like, and share in order to try and get the information across. And one thing which I saw, a quote which I saw the other day, and it just struck me, and I think I'll steal this and use it every time, that individually we're one drop, but together we're an ocean. So there's only so much that myself and Dr. Jivraj can do, sort of talking to people, talking to groups of people about the importance of booking on time. But I think together we'll be able to get the information out there to even more people, which is why I'm really grateful to you at Equal Equity for giving me this platform to speak to you, and also for the help that you'll be providing in the future as well.
No, honestly, it's so important. I'm really glad this space is around having conversations. Really, it is aimed at youth workers, but also anyone is welcome to have, to watch any of the shows that we've been doing. But this one specifically was something that was really important. So I'm really glad we connected, and I'm hoping that the work will continue. And I want people to just be able to tap in, and maybe if we can send it out on the newsletter and things like that, just to make sure that what you're saying is so important, and it's so important for the work that youth workers are doing with all the young people they're working with as well as their own individual personal lives and outside of their profession. But it's such an important topic, and specifically looking at the numbers, if we're talking about equity, then actually we need to talk about healthcare, and we need to talk about medical systemic racism. Actually, how do we make sure that women access the same level of support and care that anyone else would, regardless of their gender, their sexuality, and all the protected characteristics? So yeah, I definitely think this was just a really important conversation. So I'm grateful for your time, your energy, what you pour into this campaign it just speaks for itself, because you care, and you're doing this outside of your hours, and it's such an important such an important cause. And I would love everyone to be involved. Can they find you on LinkedIn? How else can they connect with you directly?
So I am on LinkedIn. Okay. Rosalind Gadze. Dr. Rosalind Gadze. That's how you can find me on LinkedIn.
Okay, perfect. So I hope everyone follows your journey, and just really, really embraces the campaign and circulates it within their organizations, their services. And hopefully that would also trickle down to the young women that are receiving the services as well.
Yeah, definitely.
But thank you so much. It's been so nice to have you. And it's not goodbye. I'll be in touch, and of course I will be making sure as I can tap you into as many organizations that could really benefit from the service and the campaign as well. But it's incredible. Thank you so much, honestly.
Thank you so much. Thank you for having me.
Look after yourself. I'm just going to bring Lanai. Take care, Dr. Rose. Bye.
Cheers. Bye.
I'm just going to bring in Lanai. So hello, welcome back.
That was incredible to listen to, and I think Dr. Rosa should be in every NHS spreading the knowledge.
Yes,
we just don't hear about it enough, and it's often coming from our own communities where we're doing all of this extra work to spread this information. So what an incredible woman.
What did you take from that? I think you're young, you're coming from lots of lenses. Actually, let's talk about what lenses you're coming from and the way that you see things. So you've got a youth work background, but you're also studying.
So I'm 20 and I'm currently in my second year in becoming a nurse. So that's really exciting. And that's probably where a lot of what I'm about to talk about is going to come from. But I've also been volunteering in loads of different charities for the past 5 years, particularly campaigning against sexual exploitation, domestic abuse, and especially in recent years, campaigning with the Black Lives Matter movement. So I think really I'm just going to be reiterating some of Dr. Rosa's points, but especially when looking at the disparities in maternal morbidity, realizing that it's coming from centuries of oppression in the Black community, and it's not the fault of the woman or something within Black women that is causing them to die more. It's a result of systemic and institutional racism in our health services, which come from the times in which our community was once enslaved. And this is why I always say to people, when there's a common thing often in the UK, why are we still talking about racism? Why are we still talking about slavery? It doesn't impact you today, it's all over. But in reality, because of people in the past, such as Thomas Hamilton, that did horrific experiments on enslaved Black people, trying to prove that they felt pain differently. And actually, studies show, I only have research from America, but the proceedings of National Science found that 40% of first and second year medical students still believed that Black people had thicker skin and they felt pain differently. So these myths, these historic myths, still impact our health services today. And so it's really important that all health practitioners are aware of that, because often it's our unconscious bias, right? We don't realize that all of these things from the media and everything influence our practice. And so it's really important to stay educated.
And when you say unconscious bias, I'm like, is it unconscious? Is it really unconscious? Is there something that's going on? And I think you're right. If it's in the medical books, if people are being taught that somehow Black women experience pain differently, then when a woman's giving birth and screaming for help, are people going to respond to that and I guess really look at that person as a person needing help or needing care? It's just there's just, I've got all these questions around, is it unconscious bias when people's actions actually result in people's deaths? So that element of it is actually, it is conscious bias, really. To me, it's not unconscious.
Very true. I think the reason I sometimes say that is I see myself within healthcare. There is a lot of political issues in the fact that we are horrifically underfunded. So there's a lot of staff, especially I can only speak for nurses really, but people doing 12-hour shifts, not taking breaks, doing it for decades and decades, not being able to retire, having lots of health issues, extreme fatigue, living like in poverty, even though you're actually saving lives. And so a lot of people, I think there are a lot of people that do it consciously, but I think even beyond race, mistakes happen because actually nurses and health staff are not correctly valued, and it results in a lot of mistakes happening even unconsciously. And I think, even within the healthcare system, something that upsets me is that our very NHS, the best thing personally about the UK, in my opinion, was built up by the Windrush community. And actually, how are we valuing them now? Because they contributed to creating one of the best things in the UK. And so it's difficult for me because they're also being treated with racism as staff members. So it's tough.
Is there, I guess, I don't know if I'm thinking from a perspective, from a youth work perspective, what can we do? I think, Dr. Rose had so many of these statistics, all the kind of the science, the evidence around, I guess, all the risk factors, but also the element of race and gender and all the maybe socio-economic status, all these things that might be risk factors. But I don't know, I'm just thinking from a youth work perspective, what can youth workers actually do? Like how, what can we do? Because you've done the work, you've got the lens of the medical and as well as like the ground level youth work as well.
I think something that was mentioned earlier on in the conversation about when can we start these conversations, I think as youth workers, as well as any professional, we have to remember that in today's generation, especially, young people are exposed from such young ages to loads of things that we probably wouldn't want them exposed to till they're an adult. But realistically speaking, because of, the media and things like that, there's children in primary school in year 3 that already know about so many things and are exposed to so much, especially from communities that are living in more deprived areas. They don't have the chance to be kind of cradled and protected from all of the bad things happening. And so I think being honest with young people and starting the conversations early so that they don't feel uncomfortable later on to speak about things they're going through, or feeling that they have to hide sexual activity and things like that, because it's more important to make sure they're safe and educating them about how to do things safely than to think, oh, they're too young, they wouldn't know about that. Because trust me, 9 times out of 10, they know about it. They've been there and done it. And in fact, they don't even need you to explain, you know, what things are. They just need to know where to get help. And you don't need to wait for young people to come and tell you. And this is why this is serious. You know, Black women are dying 4 times more in 2021. Let's not wait until they die to do something. And this is why it's more than a conversation. We need to take action. And it is beyond our control, but even within healthcare staff, I think taking that extra time, you know, with me, if a patient comes in, just taking the time to ask, you know, do you have any like religious requirements? Do you need to know where you can go and find space to pray if you need to do that? You know, making them aware that actually we do have translation services in the NHS that we can use at the click of a finger. And there's so many things available. We need to talk about it more. There's so many charities that are willing to support young people in this kind of stuff for free. We need to make sure that young people are versed with the knowledge to keep themselves safe.
Do you think, I'm just thinking of schools, and you've got PSHE, you might have citizenship. If they, I don't know, when I was younger, PSHE was like, you've got, you know, plastic dildo, you have to try and put the condom on, and then it's like, okay, it was very like, that is it. We didn't really have the conversation around consent, really. It was just like a very basic, very basic conversation. And I'm just thinking around, like schools and all the workshops that maybe youth workers, or sometimes youth workers or people that work within the voluntary sector go into schools to do those sessions, right? Or some of the PSHE teachers that might be watching, actually, we never know. How do people bring in the conversation in a safe way, an educational way, but also touching on the real life and all the things that maybe young people need to be aware of?
I think it's hard because as much as we have to be honest, we also have to safeguard young people. And there's a lot of young people with a lot of trauma already, and we don't know what people have been through. So as much as we have to educate people, it can be really tough to speak about these things because there's going to be people affected. And this is why statistics are hard, because they're real people. And sometimes it's very hard for us to separate that. And it can become easy to become desensitized to all of this kind of stuff. And we think, okay, like 4 times more. But imagine just one woman dying from childbirth is horrific. And the figure is so much more than that. And so I think people going in, I think the reason why I like that is I don't think it should be a teacher's job to be informing, you know, young people on all of these issues. And I think having an outside source coming in can be really helpful. And I think we need to make our kind of PSHE and sex education kind of more global and looking at different communities and cultures, because we all have different, you know, rules and values that we follow, and we have to be aware of these things. And especially with consent, like you mentioned, you know, there's a lot of young people that just, how can we teach them about how to reproduce without knowing about consent? It's ridiculous. And I think you know, even in the videos we see, I mean, they're very based on straight relationships even. So even, you know, educating young people about LGBTQIA plus relationships and different genders is really important, because we don't all look like the people in those videos, and we don't all have relationships like that. And so it's important that we're kind of aware of those things.
Yeah, I think there's so much in what you said. I know you do some online for Dr. Rose to find out that you actually do lots of online engagement, and you use social media for social good, right? And social justice. So it's interesting. You might be, you know, that might be you're recruited already into Rosa's campaign. You can be using your skills and your kind of knowledge of youth work / the medical field and your online digital skills to take the campaign to another level, maybe.
Yeah, definitely. And I definitely love to speak with Rosa more about her campaign and how we can kind of get it out there more, because I think this information should be something available to everyone. And sometimes it feels like we have to hunt to find things out. And it's really frustrating. So yeah, definitely I'd love to be part of it.
Amazing. And what are you like, what do you hope to do? Like, you finish, where are you thinking? What does the future hold for Lanai?
Really, I obviously would like to complete my nursing degree, hopefully. That's got to be the main focus. And, you know, something very personal to me, because my grandmother came from Ghana in 1948 and become a nurse and a midwife. And she was part of building that NHS. So I'm very passionate about being part of it myself. But I want to be definitely in the third sector and bringing health into the third sector, and kind of, help using health to kind of do youth work. Because I think often it feels like it has to be separated, but I think we could really kind of match them together. So, you know, if we're speaking about violence, let's actually teach young people first aid. You know, if someone's been stabbed, what do you do? And I think kind of marrying them together is really important.
There's a legacy around, I think, what Dr. Rose said around her mum. So it's really interesting, like the passion, the drive has also come from other women and everyone, both of your personal lives. So that's really powerful, just for me to sit here and reflect around, that's like the drive and the passion around the work that you're doing as well.
Definitely.
Amazing. What are you thinking around? I'm just thinking of like more, if you had to do, so if this campaign was going to target the younger audience, what can we do around having more engagement with young people? Because it's so important. I'm just thinking of the work that I've done with young women, and a lot of them have had children already. Some of them are still currently pregnant. But I wasn't aware of like having, you know, checks before 10 weeks. Honestly, I wasn't aware. So I think even for professionals that are working with young women, whether they're social care, youth workers, or any other like teaching staff as well, how do we get this message out there and engage the people that are most at risk, and having the conversations and conversations around intersectionality as well?
Yeah, I think there's a few things. I mean, maybe it will relate to kind of all generations, but I think even though the NHS is a free service, we have to remember that it costs to travel to get to hospital. If you're working full time and trying to be a single mum supporting your kids, are you going to have to take time off work to book an appointment? Are you going to have to find childcare if you've already got children and you've got all these maternity visits? So I think you know, I'm making a lot of suggestions, and I have that's probably a lot deeper kind of change that needs to happen, again, result with funding. But just being aware that sometimes things aren't as easy as we think. And sometimes when I know of a lot of young people, even friends that I've had that have been a teenager and pregnant, and just people getting frustrated with, why aren't you doing this? Why aren't you coming to this visit? And it's like, you're not seeing how complex it is. It's not just, you know, you come and you go. It's there's a lot going on in people's lives. And I think making things accessible, because there is a lot of benefits out there for mums and people. And I think we need to help them to know that help is there and how do they get it. And again, making information accessible. So not using big words and complex terminology, even if you can't get things translated, and even with you know, the pictures you're using, the importance of even things like using different skin tones, and things like that, just representing people, because if you don't feel represented, you're not going to feel safe, you know, coming into a space. So yeah.
There's so much on what you said. I'm imagining, like, this is go on this journey with me. I'm imagining a big truck that you and Dr. Rose will be driving around up and down the country, picking people up for their 10-week appointments. But look, man, it's the truth. I know we're laughing, but accessibility, like not having the money to travel and get the bus, or those things are definitely barriers. I can say that for a fact. Like, even for some young people, they can't come to the sessions that youth workers have set up or spent weeks planning if they don't have the finance to travel, but also they don't feel safe traveling for whatever reason contextually that's going on for them in their areas. Like, all of those things are definitely barriers. And I know one of the organizations I worked with, we get cabs. Honestly, we get cabs, but we can only do that for so long. If they're really high risk, we would normally book them a cab for them to come, an Uber or Bolt, to come into the office to do a session with their one-to-one worker, or if they're coming in for work. So, and I know the money is always an issue, right? All these things require finance. And we also know that actually a lot of the work that we've been doing in equal equity is around the organizations that don't always have the finance, but they are working with probably the highest risk, more number of people, but they don't always have the finance to be able to make some of these sessions accessible for the young people they're working with, like cabs.
Yeah, definitely. I think there's a lot of things to think about, and even looking at postnatal depression, there's so many things that come with pregnancy, and we need to also, not in terms of discouraging young people in getting pregnant or making those choices, but giving them the knowledge that this isn't just a baby. This is going to grow into a person, and all of the things that come with it. And we really need to make sure people are aware of the impacts it can have, because there's a lot of women going through postnatal depression and they're thinking, I'm an awful, terrible person and I can't speak about this. Especially in the Black community, we have issues in speaking about mental health, again, for inequalities I spoke about earlier. But I think, it's about education, and that's all we can do for now until politicians and systems step up. Because I think a lot of what we're talking about, my kind of question to everyone is this a question of changing systems, or is it a question of we would need to dismantle them completely and start again? And it's something to think about. But a quote from Bell Hooks that I think is relevant to why we all have a role to play is holding each other close across differences beyond conflict through change is an act of resistance. And we can all resist oppression in all different aspects of life. And when we see it, we have to destroy it. And sometimes that doesn't need to be as scary as we think at all. It can just be, making sure, again, to educate yourselves and those around you, and just remembering to be kind and think about things. And especially for professionals, I think a lot of professionals have been through things and once understood and went through stuff, and then they become professionals and get really, really high up, and it's almost like they become disconnected from the realities of the people they're working with. And we have to remember that no matter how high up we are, no matter how much we get paid, we don't forget where we've come from, and we don't forget, like, ourselves, because we all want to get up and get paid loads. But I think we have to remember why we're doing things. And
I think what you said is so important. Like, our oppression is connected, whether we like it or not. You can't talk about things. There isn't a single issue. Everything is interconnected. And I think that's the thing. If people care about gender-based violence, well, guess what? That's interlinked to everything else: race, poverty, LGBT. It's all a whole spaghetti bowl. That's the way that I like to see it. Like, I'm a visual person, but it is all interconnected. So if we care about one thing, I am definitely sure that will link into something else. And I think there's something around that. But for you, I know you've done a lot of work within the youth sector, and like, what's been the challenges for you? What have you found Yeah, what's been the challenges, and let's flip that on and say what's your hope for the sector?
I think challenges have been, I can speak, again, with the re-emergence of the Black Lives Matter campaign, which has existed since 2013, but since the murder of our brother George Floyd, there's kind of been a massive re-emergence of it. And I think during that time, there was a lot of people that did want to make change. And I remember being asked to come to a lot of talks and to speak about racism and what we need to do to change it. But I was speaking to, again, quite high up professionals, and it was almost like I needed to speak about my experiences and almost convince them of the fact that racism is existing. And it was like they were requiring Black young people to share their trauma in order to be motivated to make change. And I kind of thought, no, I want to come into spaces where we've already been past that conversation, and actually we want to talk about how do we celebrate you, how do we implement change into our systems, like instead of just talking. And that's kind of what I really want the sector to be about now, is tell me what you're going to do when I come in somewhere, and how can we follow up, because often change is made, but I want to see, but how are you going to do that in a year, and how are we going to measure that change, because it's really important, and we need to hold institutions accountable to prove to us, and it should be that way around, not us coming to them saying this is the realities of our experiences and these are the stats. I think it's more no, you need to show us how you are supporting our communities. So yeah.
I think there was something about Dr. Muna Abdi. She does lots of work around diversity, and she was talking about it from an angle of not necessarily allyship, but solidarity. So not the kind of imbalance of power and someone being an ally, but also being able to, you can be an ally one day for veganism, and then tomorrow morning you can be an ally for a different cause, right? You can flip between all of them. Whereas solidarity, she was speaking from a place of actually you're not coming to feel sorry for somebody or kind of come in as a savior. You're coming in to walk alongside somebody. And I think what you were saying was really important. I think there's a lot of, and we met at NYA. That's where we met, right? NYA Summit, Youth Summit. So it's just powerful. And same with Dr. Rose. Dr. Rose just reached out, and I think this is what this space is about. This space is about connecting with people that are doing the work and actually giving them a platform to have a conversation and hopefully inviting others. Ray says it in a really nice way. He talks about before we call out, we call in. So we're asking people to come in and walk with us on this journey. And that's what we're doing, right? This conversation around women's health, Black women specifically, and the just the horrific numbers of in terms of like they're more likely to die, 4 times more likely. All these statistics are real life, and we're asking people to to join us on this journey and support the campaign, but also support you, Lanai. Like, you're doing the work. You're definitely, you've got the heart, the passion is there, the fire is there. How can people support you? What do you need?
I think just to come onto your point firstly about that, I think it's important to differentiate as well the charities and the people that are working with diverse communities that are diverse themselves, and then charities that are helping from a place where they are not from there, and equally as great. But I think the needs are different. And I know there's been a conversation about Black excellence and how, I really want organizations, even like Equal Equity, it's about just even creating safe places and talking with each other. And even if it doesn't go anywhere, like even this conversation between the three of us has boosted me like more than ever and given me so much knowledge. And I think just that's important. And, in terms of for our communities, even for me, I look for safe spaces where I can be comfortable and I can learn from people that I know are genuinely invested in this kind of thing and know it and live it. And so, yeah, in terms of supporting me, you can follow me on Twitter at Collis Lanai. And like all my stuff is available on there, so that's the easiest way. And please hit me up with more talks and things where I can learn. That's all I'm trying to do, is just learn, because I think it's important for me to acknowledge I'm 20 and I don't know about life. I think I do, but I'm very, very young. And sometimes we see people as older than they are. I know for my mum, she would say that I'm still very much a child in her eyes. And when I turn 18, it doesn't mean I have any type of control. So I think it's important that we give young people the opportunities to learn. And that's really all I'm trying to do, to grow knowledge from people that know more. And, I'll try and speak and bring in my own experiences when I can. But yeah, thank you.
And I think what you said is so important around, again, this is conversation around young people being, I guess, not necessarily for you, but I'm just saying in general, the conversation around young people being seen as adults, though. So especially Black women, that like the adultification of Black girls and all of the conversations around that. And it's funny, I think I spoke to somebody that was saying to me, they don't like the word "you're mature for your age," because it's like, I'm not mature. Life has made me mature. Life has, because of the things I've experienced, I've had to grow up. I didn't have any other choice. So that conversation around, like this, I guess, the notion of like Black women being strong. Yes, we're definitely strong, but we also can be vulnerable. We also can need help. We also can ask for help, and we also can be in a place where we might need support. So sometimes what happens is Black women carry the world on their shoulders, their communities, their families. They are thinking of so many layers, but actually, who's caring for us?
Yeah.
So that's one of those things I think that made me think of when you were saying, like, you're 20, but you definitely, I don't know the word mature, but I would say that you definitely have lots of thinking, and the way that you think is in layers, and you thinking from a very different perspective and a wider perspective. But how can people support young people to learn and grow in a safe place, in a safe way as well, and actually provide you with opportunities? And I think a lot of, you've said that, for example, that you've been volunteering for 5 years. To me, I'm like, oh, that's a very long time of volunteering. Actually, you have the skills, you have the knowledge, the experience to be paid for the work that you're doing. And I'm being very conscious of the word equity. We talk about equity within our communities, within the youth sector, but actually equity also means your paycheck, your paycheck, so that you can live and you can survive. And because a lot of us are in the work, but we are also the community that we serve. So yeah, anyone watching this, any opportunities for Lanai, please contact her. Are you on LinkedIn? How else can people?
Yeah, I do. And it's just my name. Honestly, if you type in my name, unfortunately, there's not many Lanai Collis, so everything will come up and you'll find me everywhere. So yeah, but I think, some incredible points there. I'm just going to think, I mean, of course, during my volunteering, I was working alongside it, and actually volunteering was I wish that could have been my main job. I probably would never gone to uni because I gained so much from it. And I think, especially in the way that we, I'm sure we can all relate, but with in the Black community, kind of elders telling us from very young that things are going to be harder, sometimes 10 times as hard, and you're going to have to do this and that. And I think that's important, but also remembering to let them experience Black joy and being a child as much as possible. And it's tough because the reality is going to hit them, and how do we balance that is something I'm really interested in. Where can we strike a match where we are honest with them, but also allowing them to be children and grow in that. And I think when again in last summer also, or the one before. I do my volunteering. I was doing work with some younger children, 12 and under, and I was running kind of Saturday fun classes for them where we were just educating them on things like equity and stuff like that. And then the murder of George Floyd happens, and actually these were all Black and brown children, and their parents were saying, they're seeing this and they've got a lot of questions. And instead of explaining to them in our little Saturday classes, this is what's happened and this is racism, I told them about the kings and queens in Africa. I told them where they come from, and, trying to get them to celebrate themselves, because they know and they see it, and those children are already experiencing racism even without knowing it. And so I think it's more important for us to teach children about who they are, because if you're not rooted in anything, you can be uprooted by anything. And I think we have to tell children from young the gaps that the curriculum have. The curriculum misses like most, if not all, of Black history and how incredible we are. And so we have to unfortunately try and fill in those gaps. And we can't forget to do it, because, I found out about a lot of stuff that I think I should have known of a lot younger, about, again, kings and queens and things like that. So, yeah.
It's changing the narrative as well. And I think even the word Black history, it's just history. It's literally history and the facts of what happened in that time. And I think all the things that you were saying is just so important around Black joy, and that's just joy. But because the narrative is all around, I guess, our narratives and the way that other people see our narratives around the pain and the trauma, we don't get to just do the normal things that everyone else is doing, the joy, the laughing, that just all the day-to-day stuff that everyone else sees as normal. It becomes, I guess, even excellence. We are excellent, if that makes sense, but it's called Black excellence. But all these things that we do and are is we have been doing, if that makes sense. But because of the narrative around Blackness, and we talk about anti-racism, but specifically within equal equity, we do talk about anti-Blackness. This is a conversation in itself. And what we're saying is actually, within all of those things, we should just be able to not just survive, but thrive and live and enjoy and laugh and smile. All these things that are not always at the forefront when people think about, the community or the diverse communities over there.
Yeah, and
there's a guy that does the Black, he does the images. You've seen it. It's with the Black boys smiling. So the Black boys smiling project. That in itself is like, why do we do need it, because this is the concept and the media and the way Black boys are portrayed, not even Black men, Black young boys are portrayed, but it's just meant to be everyday life, really. But because of the systems and the structures that we live in, it becomes a thing.
It's crazy how much we have to do. When you deep it, it's really quite mad. But I have to not deep it too much, otherwise I will lose my mind surely, because it's highly frustrating, and you're so right. And it's interesting to think about, isn't it, that like, why do we have to phrase things like that? But yeah,
it's the systems in the way that we live in. And yeah, there's a lot. There's a lot. But what are your hopes? Do you qualify? Are you looking for any work at the moment, or are you traveling soon? Tell me what the future holds for you. I need to be inspired.
Well, I do hope to do a lot of traveling once I get a big grown job, so later down the line, because traveling is sadly expensive. But for the time being, I just would like to continue doing volunteering for the places that I can, because it's a really important part of who I am and my values. But also I would kind of like to be able to kind of start to transition that into more paid opportunities because I have to sustain myself. And obviously you can research me and the things that I do, but really looking to help charities with their social media, which is what I've been working with for the past 6 months now.
Wow.
Being a social media manager for a charity looking at sexual assault and domestic abuse. So yeah, really, I can do a lot of things.
Okay.
And I'm just willing to, if it's something to do with helping people, I'm there and I'll come with passion. That's one thing that I can say.
And you bring a whole heap of passion. We can't even carry it. The container's full of passion. But yeah, thank you so much. Honestly, I think it's just so important just to get your perspective, just you and your presence. Honestly, it's really appreciated. Like I said, I met you in the NYA summit, and then it was like, oh, hold on a minute, we have to connect the dots. This is an amazing opportunity, and I hope you and Dr. Rose go out there, have a van, a truck, a boat, whatever it is. And
we deserve a limo. We need a limo.
A limo, okay. That's what we're requesting. Anyone that would like to contribute, we might do a crowdfunding. I mean, you never know where things go. So yeah, honestly, it's definitely a journey. The passion is there. I genuinely wish you the best. And also again, it's not goodbye. Anything that we can do, Equal Equity will definitely do. And yeah, just thank you for your time, man. It's been a really important conversation, and so much the layers of the conversation has been really nice for me to sit and observe and be a part of.
And I'm really grateful because obviously we've had conversations, and I think it's because of women like you making space that things happen. And so like everyone applauds Milka for giving us this space because
no, you
couldn't
applaud
happen.
you all because you are doing the work. I'm just here facilitating the conversation. That's what I'm doing.
Okay, she's being humble, but you're incredible.
All right, we're all incredible. All right, let's finalize with that one.
Yeah, it's a collective.
We are amazing. But yeah, thank you so much, Lanai. And yeah, follow Lanai on social media, LinkedIn. It's Lanai Collis with a double L,
Lanai
right?
Collis. Yeah, double L.
Same on Twitter. So yeah, follow her, support her, and any roles, any opportunities, please, hook her up.
Thank you so much.
All right, peace. Thank you so much. Take care, everyone. Have a good night. Thank you.
Okay, bye.